Welcome to Act Early Save Life, a special podcast series where we speak with leading cancer specialists to raise awareness and empower early action. In today's episode, we are joined by Dr. Kripa Bajaj, a consultant medical oncologist and cancer genetic specialist from Hyderabad, to help us understand gastric cancer, its warning signs, risks, and the steps we can take for early detection and prevention. So, ma'am, my first question to you is, what exactly is gastric cancer and why is it a concern for public health?
So gastric cancer is nothing but a stomach cancer. Across the intestine we have a parts. So stomach is the very important part. It acts as a food bag to us. So in India, stomach cancer constitutes almost 5% of all the cancers. It is very important because these days rise in stomach cancer is rampant across the world, and India it is significant. Why we are so talking about it, why we really want to raise the awareness is, the symptoms of gastric cancer very subtle, very non-specific. I mean to say, why subtle? See, we have a over-the-counter medication called as Pantop. And we do hear a complaint of gas from everyone, right from our house to everywhere we used to hear the word like gas, gas, gas. So the early symptoms of gastric cancer is very subtle. If you don't pick up at the right time, gastric cancer is one of the deadliest cancer out of all. So people come with a vague complaint. When by the time they got evaluated and they got diagnosed, they become stage 4 already. That's why raising awareness about the gastric cancer is very important, because the subtle symptoms are very important to pick by the patient first. Please don't use the medication Pantop just regularly. If you're requiring Pantop medication more than 2 weeks, kindly consult a doctor, at least a gastroenterologist, and get tested. So in India, most of the people do neglect it. Many months they just use the over-the-counter medication and they just lead the time without any meaning. So that's why it's very important.
So, what are the early warning signs of gastric cancer and why are they often overlooked?
So the most common symptom what they complain is dyspepsia, means indigestion issue. Even though they take a small quantity, they feel bloated. That's the early satiety. So these are the two symptoms most commonly seen, and it's the most non-specific symptom I say. Even if we eat biryani continuously couple of days, we also feel the same for 2 weeks. So we just neglect it. We just tend to use some buttermilk, tend to use some Pantop, or tend to use some syrup. We just wait for that. So sometimes if those symptoms are significant, prolonged, we have to pick up it early. So we have to consult a doctor and get the endoscopy done. So there are two spectrums. So gastritis, we do have people who complain the symptoms, and out of 100, 80% of the times it might be some ulcer because of the stress, because of the infection, because of the food habits, or multiple times. And out of 120 will be early cancers or already established cancers in the stomach. So these are the things which we have to pick up. Please don't endorse any over-the-counter medications, and please get evaluated. And also, why is it important to evaluate for the gastric cancer as gastritis also? Over-the-counter medications will not help the gastritis and gastric ulcers to get healed or treated. You definitely have to consult a medical expert. And also, you can have a chance of 20% chance of having a cancer. So it's important both for the treatment of the gastritis, ulcer, as well as early pick of the cancer to meet a medical expert. So endoscopy is a simple one, which is just a 10 minutes procedure which can be done. So by doing endoscopy, we can understand what is the reason the person is having prolonged complaints.
Is gastric cancer hereditary?
Yeah, gastric cancer can be hereditary. Up to out of 100 gastric cancers, 6 to 8% of the gastric cancers are hereditary. Hereditary means the person will have a family history of cancers. It's not just gastric cancer. The person family members might get affected with ovarian cancer or uterine cancer or breast cancer, or series of patients in a generation will get affected with some non-specific cancers. So when someone is inheriting the gene which is having a risk to induce cancer in a person, we just have to, for suppose it's a common question for us to ask, is there any family history of cancer? Be it any cancer, be it a breast cancer, ovary cancer, gastric cancer, we do ask this question. Are there any other members in the family got affected with the cancer? Why is it so important? Means why it's very important to ask that question in cancers, because cancers can be acquired because of the abnormal genes from the earlier generations. If we acquire those genes, we have a tendency not to just get affected with one cancer. It can be a spectrum of cancers, spectrum of things which we can get affected. For suppose I got an early stage of some cancer, but I have a gene which can induce other cancer also in future. I'll be more aware of that cancer symptoms and signs also. And not just that, if I am acquiring some gene abnormality from my previous generation, I will also transfer my abnormal genes to the next generation. Trust me, Kartika, there are very good tests these days, pre-implantation genetic testing. So, for suppose I got picked up with an abnormal gene in my blood, so then I want to plan a pregnancy. I'll not just go with the regular process of pregnancy, I would rather pick up the IVF, in vitro fertilization, so that my embryos will be tested prior to the implantation in the womb, whether it is an abnormal gene or normal gene. So a person with abnormal gene will have a half normal genes and half abnormal genes. It's always 50% risk of transferring that abnormal genes to the next generation. If I get tested my embryos early before the implantation, I can pick up the healthy embryos. I can prevent the transfer of my abnormal genes to my next generation, so that they'll be saved, and also myself will be saved from the next cancer, or I'll be in a continuous scrutiny to pick up the early cancer signs and symptoms and all. So all these things are very important.
Is it really common to have this type of cancer? Gastric cancer?
Gastric
Is it
cancer,
really
yes.
common?
If you see parts of India, if you see the West Bengal side, Bengal people will say a constipation as well as gas as a common complaint. If you pick up 100 Bengalis, out of 100 Bengalis, you will hear at least 95 people saying the complaint of gas and constipation. And out of India, Bengalis have a highest incidence of stomach cancer. The reason why they have a significant stomach cancer incidence is because of the food habits. They do have a significant consumption of smoked fish.
Also, they eat
Fish.
spicy.
Yeah, spicy. And fish is their staple food. Fish they just eat like vegetables. And the fish, the way they consume is different. The charred fish, even we do hear the barbecuing is not really healthy. So they continuously, daily for many years, they do eat a smoked fish consumption is very rampant there. And also, as you rightly mentioned, the spices are also, ingredients also very different. And why ulcers are also can cause cancer is, if you see there is a continuous injury in the body, continuous inflammation in the body, that will definitely lead to the cancer. So if you have a continuous gastritis, a person got affected with the gastritis, if it is continuous prolonged for many years, that ulcer itself will turn into malignant, because the cancer is nothing but a normal cell becoming abnormal because of the continuous stimulation, be it an injury, be it an inflammation, be it a genetic disorder, anything can induce the stimulation of normal cell becoming abnormal cell.
So, who is at higher risk for developing gastric cancer?
So the person whoever is having a alcohol consumption, smoking consumption, these two are very rampant in the young generations. If you see, than prior, almost 2 decades, younger people are getting affected with the stomach cancer. The reason is purely because of the lifestyle habits. Abnormal fatty consumption, abnormal levels of alcohol, binge alcohol consumption, smoking consumption. You name anything which cause induced inflammation in the stomach, that will lead to cancer. If someone is continuously taking a spicy food for a long time, that will induce ulceration. That will lead to cancer. So, excess spicy food, excess smoked food, excess charred food, excess alcohol consumption, smoking consumption, that will lead to cancer. And one more thing to add on, H. pylori. See, there is an infection called as H. pylori bacterial infection in stomach. We do hear a lot of women who doesn't have any history of smoking alcohol, or without any history of family history or any smoked food consumption history, they do have a cancer. That is purely because of the bacterial infection. In India, H. pylori infection is very common. This H. pylori will initially induce simple gastritis. This gastritis, if it is prolonged, the infection is not cured. That will lead to inflammation, which further leads to the cancer. So try to avoid anything in the body which will induce inflammation. For that matter, any cancer will be led prior by the inflammation. In stomach, the inflammation is not just because of the lifestyle habits, The inflammation might be because of the infection also. If someone is having a prolonged gastric issues, if it is simple gastritis also, it's very important to test for H. pylori infection and get treated for that.
How does chronic gastritis lead to cancer and how can it be prevented?
So, as I mentioned, anything which is prolonged will lead to cancer. So, gastritis is very important to pick up early. Uh, I have many people who are consuming Pantop for many years, 6 years, and they can't really get off the Pantop. They say, if I don't consume the Pantop, I can't eat the food. I'll have a lot of burning sensation in my abdomen. So that was the complaint. When I was doing internal medicine practice as a physician, I do hear from many people. They just can't cure it. You name like the chronic gastritis can be cured with the right measures. So you have to pick up what is the reason for the gastritis and also what is the current state. The chronic gastritis can be very subtle or then it can lead to ulcerations also. The first goal with us is to heal the gastritis is nothing but inflammation, and with the ulcer is nothing but a breakage of the barrier. So first we have to heal the barrier, we have to decrease the inflammation, and also what exactly is causing inflammation we have to work out. For suppose is it a H. pylori, there are tests for H. pylori. If H. pylori is causing the inflammation, we have to treat the H. pylori, or if the patient food habits are causing the inflammation, we have to treat that. Or sometimes people cannot get rid of the stressful lifestyle. They do have a continuous stress. If you see, anxious patients have a significant increase in ulcer formation in the stomach. The reason is anxiety also, or high level of corticosteroid in the body also will lead to excess acid production. If beyond one level the acid production is there, that will lead to ulceration and gastritis. So exactly what is triggering we have to work up and we have to treat that, and also we have to heal the barrier. Just like how do we have a skin on the body, just like that there is a mucosa in the intestine. We have to heal it and we have to nurture it, which is most important.
Are there any foods that would predispose a person to gastric cancer?
The foods which is especially have a significant association with stomach cancer is the smoked food. So the charred food, we do see a lot of barbecued broccoli, like broccoli is very healthy, but people do love getting it grilled. So try to avoid the charred food, the one which is a smoked food. So please don't consume smoked food because the smoked food will lead to carcinogens. The groundnuts are there, excess smoking of the groundnut will lead to black discoloration. That is actually a carcinogen. Carcinogen is nothing but it will catalyze the process of inflammation to becoming a cancer. So please try to avoid any smoked food. Be it a non-vegetarian food, be it a vegetarian food, please don't smoke the food. Just eat in a healthy way. Raw food or boiled food is very healthy. To a certain extent, roasted food is healthy, but not a proper smoked food. That will lead to a normal tissue into a abnormal tissue, which is not at all good for health. So please try to avoid it. And also, there are nuts. If nuts got spoiled with some fungal infection, that will lead to cancer. That has a significant association not with just cancer, but also liver failure also. So when we are consuming nuts, we really have to be aware. If you see the black dots on the nuts, it's very common for us to see black dots on the nuts.
That white dust also.
Yeah, white dust as well the black spots, those are nothing but a fungal infection. If we see those kind of thing, please try to avoid. Better not to consume than to consume it. Because the fungal infection will lead to a significant toxin production in the stomach, which will destroy the stomach lining. We call it the aflatoxins. So please don't eat a fungal infested nuts, which is not at all good for health.
So can gastric cancer be cured or treated?
Yes. So it depends on the stage of the cancer. Finding an early stage of gastric cancer is like out of 100, I will just only see 35 to 40% proposition is the curative stage. The word curative means up to stage 3, we call as a curative cancer. Stage 4, we don't call as a curative cancer. Up to stage 3, very early we do take up a surgery first. If it is stage 2, stage 3, we try to give chemo, surgery and chemo. This is the regimen. Stage 4, we don't title as a curative cancer. We just try to treat the cancer and we try to prolong the lifespan. For suppose out of 100, the median survival of stage 4 stomach cancer is 1.5 years to 2 years maximum. So if ever someone is not responding, they can succumb within 6 months also. It's just a very limited lifespan, 1.5 years we can say. But up to stage 3, we can cure it, we can have a normal lifespan to the person.
What practical steps can public take to reduce their risk of gastric cancer?
So whatever you are like taking, consuming, that you have to be conscious about, and your lifestyle. So whatever you're consuming is like what you're eating technically. So that you have to be really cross-checked. So we already discussed healthy, fresh vegetables, greens inclusion is most important. When you're consuming, please try to take a balanced diet. Balanced diet means right proportion of protein, right proportion of carbohydrates, and right proportion of greens, leafy vegetables, and everything. When you're consuming that, consume it in a fresh manner. And you always cross-check the quality. Even though you take a little, try to have a good quality food, which is very important. And lifestyle. Try to avoid smoking and try to avoid binge alcohol, or try to avoid regular alcohol consumption, and try to maintain a limited consumption of everything. Be it a food, everything, please make sure that it is just limited. Nothing should be binge. The obesity, the sleeplessness, the anxiety, everything you please cross check. So that's what we advise all the, not just stomach, Kartika, like all cancers will have, these factors will lead to the cancer incidence.
Why is early screening and prompt medical attention so important for gastric cancer?
So gastric cancers, picking up stage 1 gastric cancer is unheard. It's like very, very rare for us to pick up stage 1 gastric cancer. So from stage 1 to stage 2, stage 2 to stage 3, stage 3 to stage 4, the survival rate will decline. So if you pick up in the stage 1, survival is going to be as good as 95%. Out of 100 people, 95% people will survive well. If it is stage 2, 80% people will survive well. If it is stage 3, only 60% or 55% will make well. So why we are so much stressing is picking up gastric cancer in early stage is very difficult, because patients just don't approach doctor at right time seeking care, because they just most of the times do use over the counter medication, neglecting that. And because of the work, for suppose people who are just like occupied and consumed by their work or regular daily chores, they'll not come until it is really significant. So I have many patients who come to hospital once they started having a bloody vomiting or black color stools or significant abdominal bloating with a stage 4 metastasis, some fluid in the formation in the abdomen. It's very common in India to see. Only very educated people who are really health centric, only they come to hospital for checkup. It's very rare for us to see a person approaching a doctor in the early stages. The purpose of this podcast should be early awareness. People should pick up the symptoms. If there is any deviation in the normalcy, they have to approach a doctor. Getting a simple endoscopy done, it will take only just 10 minutes. But that will have a huge impact on the health. For someone having a chronic gastritis, they can't consume food, they can't enjoy the food, they can't have a regular lifestyle. They don't sit still because they just don't want to get it done, get the evaluation done. And that chronic gastritis will lead to cancer. If you pick up that early, if you treat that early, that will not lead to cancer. And most of the times, they just neglect it. They just push it with the pantoprazole or sucralvo. When they go to any medical shop, any pharmacy, they'll just prescribe that and they'll just take it. They don't approach a doctor. And it's very important to pick up early. If you don't pick up early, that will just going to escalate. Once it got into stage 4, it's a irreversible turn. No one can save them. It's only just a few months left with them. If they come at early stage to us, we can evaluate, we can do best service to them, and they can lead a normal life again once the treatment got completed. One, prevention is most important in gastric cancer. For God forbid, no one should get it. If ever they get the symptoms, they have to be conscious about, they have to get evaluated, and they have to get treated first.
Do certain foods fight stomach cancer?
So certain foods means like the one which will calm the inflammation in the body will certainly lead to decrease in gastric cancer. For suppose in gastritis, if you see chronic gastritis, we do encourage people to take a more milk-based foods, milk alkaline food, I mean to say. If you hear the alkaline water is very good for health.
Encourage or discourage?
Alkaline water, alkaline foods we do encourage when someone is having gastritis, because that will nullify the acidity in the stomach. When the acidity got nullified, that will lead to reparation of the tissue, that will lead to improvement of the tissue. And also along with that, if you consume more antioxidant rich foods like greens, vegetables, so that will lead to healing, more healing, much benefit. and also imbibe omega-3 fatty acids in the food. Omega-3 fatty acids are like astaxanthin. It's a vitamin C or other form of vitamin C, which is like much advanced than vitamin C. So I do encourage all my patients who are above 35 to take omega-3 fatty acids as well as astaxanthin, because this will calm down the inflammation in the body. It will not just only improve the skin health, hair health, but in general and body it will decrease the inflammation, which is very important. And also oranges, citrus fruits, oranges and also other like a pomegranate and all, that will have a significant amount of vitamin C, amla. So previously ancestors used to make a chavanprash out of it, amla. So daily they have to consume a certain amount of amla daily. Every person has to consume, but none of us are following it. So amla is a significant source of vitamin C. If you eat amla one per day, that will lead to a very good replenishment
But
of
the
vitamin C.
candies are not.
No, candies absolutely no. Candies are like with the preservatives. It is like a soaked in significant concentrated fluid, which we are not suggesting. But the fresh amla, I mean, when someone take candy, but why not fresh amla? Fresh gooseberry is a very good source of vitamin C, and the replenishment of vitamin C in the body will not just improve your skin, hair, or like just simple pigmentation issues, but it will also repair the body as whole. If I say please consume this for improvement in the gastric cancer, no one will consume. If I say something you will look good, your skin will be better by consuming this, people do come forward, everyone start consuming it. But most important is your skin is also an organ, it's the largest organ in the body. Just like that you have a liver, you have heart, you have everything. So consuming more antioxidants will help the metabolism in all organs in the body, and that will definitely fight the free radicals, that will decrease the aging signs, that will only going to improve your general quality.
So my last question to you is, how does a multidisciplinary medical team improve the care and outcomes for gastric cancer patients?
I'm a medical oncologist, Kartika, so I will not intervene a person who is having a very early stages of cancer. So if someone got a stage 2 or stage 3 cancer, so certainly what we do is, the goal is to improve the outcome. In gastric cancer, only two modalities are involved, surgeons as well as chemotherapy specialist medical oncologist. As the stage increases, so medical oncologists do intervene. We call it a chemotherapy. Even the curative stages also we do give chemotherapy. So curative stages, as per the stage, will introduce a neoadjuvant chemotherapy, the one done prior surgery to decrease the disease bulk, and the disease will be removed with the surgery, and post surgery again the chemotherapy will be given to eradicate any spillovers in the body. So in curative stage, I do intervene as well as the surgeons also intervene. Once it is a stage 4, the more role of chemotherapy will be there, because surgery will be futile unless there is some obstruction, significant issues are there. That's what. So everyone will have a step in the management of cancer patient, be it a curative or be it a palliative setting. Surgeons, radiation oncologist and medical oncologist, they sit together and they chalk out a plan at the baseline. While the patient just presented, then only the decision will be made what will be the future course of this patient. So who has to intervene early? Whether the chemotherapy expert has to intervene early or the surgeon has to intervene early, it depends on patient general condition, patient stage and everything. We'll put together, we'll chalk out the plan. We do call as a tumor board. For all cancers, the day the patient presented to us, we do discuss in the tumor boards and we do navigate the plan for the patient so that the patient will have best outcomes. In oncology, it's always a teamwork. All three experts has to sit and has to structure a plan for a patient so that patient will have a best outcomes possible.
Thank you, Dr. Kripa Bajaj, for sharing such valuable insights on gastric cancer and why early awareness truly saves lives. That's all for today's episode of Act Early Save Life. Stay tuned for more such expert conversations that can help you stay informed and proactive about your health.